Hello everyone, and welcome back to my channel. In this video, I'll be talking to you on kidney stones, causes and risk factors for kidney stone signs and symptoms, treatment of kidney stones, and how you can prevent kidney stones. There is an emergency associated with kidney stones which you must be aware of, so keep watching and watch till the end. Now, what are kidney stones? Kidney stones, also known as nephrolithiasis, simply put, is the presence of hard particles, rocks, stones in the kidney. How are they formed? Kidney stones form when substances in high concentration in the urine stick together. As they stick together, they form crystals, and these crystals adhere to the kidneys. As time goes on, more and more particles attach to these crystals, thereby increasing in size and hardness. Kidney stone is a global disease. Data suggests an increasing prevalence, likely due to westernization of lifestyle habits such as increased BMI and change in diet. Types of kidney stones. We have the calcium oxalate kidney stones, which forms about 75% of kidney stones. Calcium phosphate, about 15% of kidney stones. Kidney stones made of uric acid and cysteine. What are the risk factors associated with kidney stone formation? 7 risk factors. 1. Decreased fluid intake. Decreased water intake. With increased water intake, you pass more urine, and the likelihood of stone formation decreases. Now, what do I mean? As you increase your fluid intake, you pass more urine, and it's less likely that kidney stones will form. Now, with a decreased intake in water or in fluid, urine output decreases, and there's an increase in stone formation. Now, when urine output is less than 1 liter per day, the likelihood of kidney stones forming actually doubles. Number 2, excessive intake of animal protein. This increases the risk for kidney stone formation. Excessive animal protein intake increases your calcium excretion, increases your uric acid excretion, and decreases your citrate excretion. Number 3, increased sodium consumption. Number 4, increased fructose and sucrose consumption. This all increases your risk. 6, environmental and occupational influences that may lead to a decrease in your urine volume, such as working in a very hot environment or in an environment where you lack access to water. And 7, medical conditions that are associated with kidney stones. There are several conditions that can predispose to stone formation, like Crohn's disease, having a gastric bypass surgery, primary hyperparathyroidism, type 2 diabetes mellitus, and distal renal tubular acidosis. What are the symptoms of kidney stones? First, you could experience flank pain, kind of severe pains by your flank that radiates to your groins with associated nausea and vomiting. There could also be painless gross hematuria, that is the presence of blood in your urine. How is kidney stone diagnosed? From the history and then to physical examination, you would need a physician to examine you, and then some investigations, some tests will be required of you to do, such as urinalysis. Now, urinalysis done can reveal crystals in your urine. Also, hematuria can be seen, that is the presence of blood in your urine. Imaging studies can also reveal stones in your kidneys. A helical CT without contrast is required, as well as a renal ultrasound scan can be used to identify the presence of kidney stones. Treatment. Now, for treatment, if there are kidney stones and it's symptomatic, no symptoms, no treatment is required. Now, for stones with symptoms, treatment could be based on if the stones are small or the stones are large. Now, symptoms with small stones, these stones can actually be passed in urine. So drinking lots and lots of fluid, lots and lots of water, at least 3 liters of fluid per day is recommended, so that these stones can be passed in your urine. Now, you have to work with your physicians to come up with the exact amount of fluid that you require, especially if you have coexisting medical conditions. Pain medications are indicated to control the pains associated with kidney stones. The non-steroidal anti-inflammatory drugs help with this pain. Again, you have to speak with your physician to get the right medications, the right pain medications for you. Now, with the small stones, when the small stones are passed, it's recommended that you catch these stones and send for analysis. For large stones with severe symptoms, you may require hospital admission where you'll be placed on intravenous fluids because the kidneys have to stay hydrated. So fluids through your veins will help. Also, the severe pains that comes with these large stone sizes would require intravenous pain medications. Now, at this point, a consult to the urologist is indicated, and you could have a uteroscopy done, or you could have a shockwave lithotripsy done. Now, in shockwave lithotripsy, shockwaves are used to fragment the kidney stones to tinier stone sizes that can be passed in the urine. There is a urologic emergency that you must be aware of. Now, although kidney stones do not directly cause upper urinary tract infection, however, a UTI, urinary tract infection, in the setting of an obstructing stone is a urologic emergency, which you must know of. It's commonly called Pus Under Pressure and requires urgent urologic intervention to re-establish drainage. How can kidney stones be prevented? The process of stone formation may begin years before a clinically detectable stone is identified. So, cultivating healthy habits for your kidney care is vital. I made a video on 12 tips for a healthier kidney. Be sure to watch that video after this video. So, stay hydrated. Drinking enough fluid, enough water every day helps the kidney to make more urine, thus decreasing your risk of developing kidney stones. Limit sodium intake. Maintain the recommended daily allowance for calcium. Consume more foods that are rich with citrates. What are the examples of fruits or foods that we have rich in citrates? We have the grapefruits, lemon juice, pineapple juice, orange juice. Now, avoid excessive intake of animal protein. Ensure to incorporate these healthy tips into your day-to-day life to prevent or to reduce the risk of developing kidney stones, as kidney stones could get complicated and lead to renal impairment. So if you found this video helpful, don't forget to give it a thumbs up, subscribe to my channel, and share this content with your friends. Thank you very much.